Assalamu alaikum. This is the pedicle of the right kidney, which is having 4.2 centimeter mass arising from the upper pole and growing towards the pelvic ileal system, centrally located mass. So partial nephrectomy is not possible. That's why after counseling the patient, we have decided to go for a radical nephrectomy. Since it was centrally located, true cut biopsy could not be taken for the risk of bleeding. So we had to go for a MIVI scan to know whether this mass is benign or malignant. And after getting the report, there was a cold nodule and cold mass. Most likely it was a malignant mass. So we counseled the patient regarding the prognosis and also did a CT scan 4 weeks apart, and it also showed increase in size from 3.2 to 4.2 centimeter. So that's why we decided to perform laparoscopic radical nephrectomy. And now here you can see that the pedicle is unusual. Usually the artery will be located posterior inferior to the renal vein, but here you can see that there is a sizable artery which is superior to the renal vein. So we clip the artery first, making a small window so that the vein gets collapsed. It is a good opportunity to place another clip here. But we can see that there is a pulsation towards the upper pole, and it raises our suspicion of another artery. Here you can, this is the adrenal gland. So, but this vein is collapsed, which is right in front of us. It is not distending, so it has a temptation that the pedicle may be complete, but actually this is the vein of the artery that we clipped. And as we saw another pulsation in the fat of the upper pole, we looked for another artery and we found it. So if one artery was clipped and the vein collapsed and was not distending, and there was another artery, so it was a clear-cut indication that there must be another vein as well. You can see the artery far much superior to the first artery. The CT report also showed that there are two arteries which are coming behind the inferior vena cava towards the kidney. So as the superior artery seems to be the artery supplying the tumor, so there is a little more inflammation around this artery as compared to the artery which we clipped previously. So coagulating and cutting the lymphatic tissue, but with caution, because we suspect that there might be another vein, and making the window for this second artery may injure the second vein in the process. So that's why we are a little more cautious and careful. Now a small window has been created, but it is very difficult to place this clip because the IVC, the previous artery, the clips applied on the artery, all are limiting factors, and we have that in mind that there might be another vein as well, so we cannot push and pull too much. So we have to apply the clip blindly, which again is not a desirable action because it may catch half of the wall of the vein, and this may lead to a disastrous bleed. So this artery and this vein, clearly visible, are almost devoid of the circulation. Now there is no blood in the vein as well, and it has collapsed completely. Since we need to apply 3 clips on the vein, that's why we need to have a good length of the vein. So and we have in mind that the first vessel to be divided will be this vein. That's why we need to secure it very well, so that we will proceed with the rest of the arteries and the vein without being troubled. So the right angle to complete the dissection posterior to the artery, again keeping in mind the additional vein which we have not yet seen. And in the process the liver has dropped down, so that is also making a little bit of hindrance. So a nice clip is applied here, then the liver is lifted up, and then the distal clip is applied. So we apply another clip proximally, and then we cut in between in bits, not completely. There is no bleed, so we cut it boldly. Now we can see that there is another vein, and it was very close to the previous vein. So now we decide to clip the artery that we already have clipped, and then divide it, and hence it will be then easy to clip this second vein as well. Now we can divide this artery safely. So 3 small clips we have applied on this. Since we have applied small clips, the green color clips, that's why we applied 3, just to be on the safe side. Now dividing the tissue around this vein, so that we may find a window around this vein, and then clip this vein as well. In the process we have used a lot of clips, and at times if the clips are more, then any further clip application becomes a little bit difficult. So the vein is collapsed, we have checked it. We divide this fibrous tissue. Now the right angle to complete the posterior dissection. Yes, this creates a window which is sufficient enough to apply 2 clips towards the big vessel and 1 clip towards the kidney. Again cutting in bits and pieces, and now comes the last part of the pedicle, which is the bigger artery supplying most probably the tumorous area. So we must take care manipulating the already clipped vessels, because too much manipulation, pushing and pulling can be dangerous, because it may lead to dislodgement of the previously applied clips. So clip is applied proximal to the previous one, and another clip is applied with a little bit difficulty, of course. So we are now secure. Now we can safely dissect the artery further without danger of any bleeding. Hence we will apply another clip distally and then divide this artery as well. Thank you very much for watching.